The vascular access is the hemodialysis patient's lifeline, so careful attention to creation, maturation, and maintenance of the native AV fistula is critical. Without adequate vascular access, delivered hemodialysis therapy is compromised. This can lead to increased patient morbidity and mortality.
I'm Dr. Larry Spergel, and I specialize in vascular access surgery for hemodialysis. As a surgeon, it's my responsibility to provide the best possible blood access for my dialysis patients, whether that be a native arteriovenous fistula, an arteriovenous bridge graft, or a catheter. Unfortunately, over the past decade, there has been a significant shift from AV fistula to AV graft as the primary access for chronic hemodialysis. But recently, because it has been shown that AV fistulae have a much lower incidence of infection and thrombosis and a longer survival rate than AV grafts, the DOKI guidelines recommend that this trend to AV grafts needs to be reversed. The DOKI guidelines recommend that optimally for their permanent hemodialysis access, 50% of all new ESRD patients should have an AV fistula attempted, with the expectation that 40% of prevalent ESRD patients will have a functioning AV fistula, less than 10% of chronic maintenance hemodialysis patients should have catheters, and the remainder will have AV grafts.
Some reasons for this trend towards placing AV grafts rather than AV fistulae are an aging ESRD patient population. About 40% of these patients are diabetic. For a variety of reasons, blood vessels in this patient population are often not suitable to support an AV fistula. Late referral of ESRD patients to the nephrologist and surgeon. Grafts are easier to create, more vessel options are available, and grafts can be used early.
While it is not always possible, an AV fistula should be constructed long before initiating hemodialysis. DOKI recommends 3 to 4 months, but sometimes even a longer period is required. Common types of AV fistulae that may be created, depending on the condition of the individual patient's vasculature, are the radiocephalic, the brachiocephalic, and the transposed bacillic vein fistula. If dialysis is required before the AV fistula has matured, a bridge device such as a tunneled cuff catheter would be recommended, and there's a new generation of bridge devices currently under development. To determine if an AV fistula is a suitable choice of access for an ESRD patient, it is important to take a detailed history and perform a complete physical examination. I'm going to have you make a fist, which will drain all the blood out of your hand, real tight. Then I'm going to compress these 2 arteries. So I cut off the blood supply temporarily. You can open your hand, and it's all blanched there. It's all white because no blood's going in there. Now I'm going to release the ulnar artery, and you can see how it fills with blood. That means you have an excellent blood supply just from the ulnar artery alone. To optimize the viability of the blood vessels, it is important to advise the patients as early as possible to protect the vessels that may be used to create the arteriovenous fistula. Once we do this fistula, construct this fistula in your arm, we want to protect it.
Protecting the blood vessels means that patients should avoid venipuncture, placement of central venous catheters, and blood pressure readings on the non-dominant arm.
And you know, we've talked about how bad smoking is. Is there any way that you can stop the smoking?
Patients should be encouraged to stop smoking due to the adverse effects smoking has on blood vessels.
Lifting light weights and performing hand exercises may help the patient develop better quality blood vessels that will increase the chances for a successful arteriovenous fistula. Vein mapping is a helpful tool for surgeons to utilize when there is a question of suitable vessels. It helps identify where the best vessels are and improves the likelihood of creating a successful AV fistula. It looks very good, even though it's just been a short time since the surgery.
After the AV fistula has been surgically created and before the patient is discharged, it's essential to give the patient instructions for monitoring the access long term.
If you have a problem with the surgery or with the fistula, you call me.
These instructions should include a list of signs and symptoms that may indicate potential complications, and letting the patient know whom to call in the event problems arise. The hemodialysis caregiver plays a significant role in the success of the AV fistula. The caregiver should review the surgical report, which should include a drawing of the AV fistula placement. Check the date of the access placement to make sure adequate time has passed for healing and maturation. The DOKI recommendation is a minimum of 3 to 4 months.
Hi, I'm Deborah Brower, one of the original members of the DOKI Vascular Access Work Group. Key to successful AV fistula maturation and maintenance is the communication between the caregiver and the patient. In other words, talk to your patients. Have you had any changes in your arm?
No.
Any numbness, swelling? We're going to assess the patient's access, visually inspect the access for the color, look for any redness, bruising, check the extremity, check for swelling, coldness, numbness, assess the access arm compared to the non-access arm for the edema, coldness, and numbness. Going to assess the fistula. Start first by feeling for the pulse. Start at the arterial anastomosis and work up the fistula. Feel the thrill and the temperature throughout the fistula for any signs of infection. Also check for any hardens or unusual areas throughout the fistula that may represent an aneurysm formation. I'm going to listen to the entire fistula for the bruit. Start at the arterial anastomosis and work up the fistula. You're listening for the intensity and the pitch of the bruit. A change in the bruit may indicate a developing stenosis.
After auscultation, the next step is to cannulate the access. When cannulating an AV fistula, insert the needle at a 25-degree angle as recommended by DOKI guidelines. For complete cannulation instructions, please refer to Medisystem's video, Steps to Optimal Cannulation.
During dialysis, avoid hypotensive episodes. To maintain blood pressure, use supportive measures such as sodium variation and ultrafiltration modeling for those patients for whom it is appropriate. Avoid excessive pressure during post-dialysis hemostasis.
Mr. Abel, we need your help in assisting us in keeping your arm patent.
The patient is a true partner in maintaining a functional AV fistula, so patient education is important.
A very important part of this is also hygiene.
When teaching patients about care of their AV fistula, topics you need to cover include the importance of hygiene and avoiding constrictive clothing and jewelry.
Jen, one important thing that you can do to help is to use something to squeeze.
Patients should be familiar with exercises that will help them develop the blood vessels in the AV fistula.
You need to look at it carefully every day and inspect it to make sure there's no swelling or redness.
Patients should learn how to conduct a daily visual inspection for color, temperature, pulse, edema, pain, and unusual changes. And they should know how to contact their physician or vascular access coordinator immediately if any unusual symptoms develop.
If you notice anything out of the ordinary, you should call either the clinic here or your doctor.
To review, the keys to achieving a successful AV fistula are early referral, patient counseling about protecting their vessels, good surgical judgment and technique, an adequate maturation period, good communication among the surgeon, the dialysis care team, and the patient, routine monitoring and documentation, and proactive timely intervention if the AV fistula is not functioning properly.
Remember, successful vascular access is the result of teamwork. We hope this video will be helpful as you care for your hemodialysis patients. Thanks for watching.
Medisystems manufactures a wide range of products for hemodialysis, including bloodlines, dialysis priming sets, transducer protectors, fistula needles, and safety needle devices. For more information or to find a distributor of Medisystems products, call 1-800-369-MEDI. And remember, to get Medisystems products, you need to ask for us by name.